Hi, this is Mike Rothschild, and today we're going to talk about diabetes in the eye. As you know, millions of people in America have diabetes, and it's a growing problem within our country. And one of the biggest problems that can come out of having diabetes is damage to the eye. When I talk about diabetes, the way that I understand it is that it is a problem where the blood sugar levels have problems being regulated. So you get too much sugar or glucose within the blood. And just like jelly or molasses, when the blood gets too high or the sugar gets too high in the blood, it gets kind of thick and it doesn't flow as well through the blood vessels. When you have blood that is not flowing through the blood vessels very well, parts of your body that have a lot of blood vessels, especially a lot of delicate blood vessels like the eye, can become damaged. And so it's very important that we watch for signs of that in the eye. And the biggest thing that we're looking for is something called diabetic retinopathy. So as you're going to see on this video, you'll see that we're going to actually go into this eye and we're going to see the back part of the eye, which is called the retina. The retina has a lot of blood vessels, and it's the only place where we can look directly at the blood vessels. So the nerve comes from the back of the eye, and the blood vessels travel through that nerve into the eye, as you can see sort of depicted in this graphic here. So when we, during your eye exam, are looking inside your eye, whether we're looking at an OptiMap image or whether we're looking directly with a lens, we're looking for these signs within your eye. We look directly at the blood vessels and we look for them to have a normal shape. And you may be able to see in this part of the picture here that there are some new curvy little blood vessels right here that don't look like they fit with the rest of the blood vessels. Those are new blood vessels called Neovascularization, which is an indication that the body is trying to grow new blood vessels, and these blood vessels often leak and cause problems because they're not mature. The other thing that we look for is these little yellow spots right here. Those are called exudates, and that's where part of the serum from the blood is leaking from the blood vessels and can start to cause some scar tissue and damage throughout the eye. But the biggest thing and the most common thing that we see in diabetes in the eye is these little puddles of blood where the blood vessels have been damaged to the point that they're starting to leak, and we see puddles of blood, which means that if we're seeing it in the eye, it may damage the eye, but it's probably happening in other parts of the body. Now, in future episodes, we're going to be talking about something that doesn't show up from the blood vessels, but something called macular edema, which is another complication with the eye related to diabetes. So please stay tuned.